Hi, I'm Dr. Joel Marley, and I am the clinic director at Family First Chiropractic, and I'm here to talk about TMJ, or TMJD, or TMD. And what that is temporomandibular joint disorder, dysfunction, pain in your TMJ jaw joint. So if you're struggling with pain in your jaw, pain around your ear, pain across your face, clicking, grinding, popping, can't fully open, can't fully close, chewing of food causes pain in your jaw, this video is for you. So I want to illustrate how at Family First Chiropractic we get to the root cause of TMJ joint pain. So there's an estimated 15 million sufferers with this debilitating pain in the face. And the jaw is so intricate. This gingivalis hinge diathyroidal joint is so densely populated with neurons that the swelling, fixation, the crepitus, the grinding can cause some of the most excruciating pain on the planet. I'll never forget my first case of this when I opened Family First Chiropractic. Was a childhood friend of mine brought in his wife, and she had been struggling with TMJ joint pain. And it got to the point where it was causing her headaches as well. It was causing pain in her jaw. It was also causing a locking of her jaw. And she went everywhere. She spent hundreds and hundreds of dollars at dental offices to look at teeth and to shave down teeth, and an oral appliance so she didn't grind, a bruxism device so she didn't grind at night. And she shows up in my office from a trusted childhood friend of mine, and after we found the cause, and she had phenomenal successes with her adjustments, her lifestyle modifications, that she later told me that this pain was so debilitating that she was becoming depressed before we found the cause. So I want to illustrate how we determine and examine the spine, the patient, the sufferer. First, we'll start with a history. We want to know, have you had a recent trauma to your jaw? Was there a car accident, a flexion, extension, like a whiplash that occurred? Has there been a history of extensive dental work or dental procedures where you may be forced open while under a Novocaine, a relaxer of the muscles to even force it open further? Has there been stress, a significant amount of stress in your life causing a clenching, a grinding to your jaw? Now, observation is next. We want to know what is happening inside your spine, but also your jaw joint. We start with the cervical spine because we know that your cervical spine and your jaw are very intricately connected. First, posture. So if the head is deviated from center, as this x-ray shows behind me, deviated off of center, that changes the mechanics of the jaw. From the side, if your posture is poor and your head is forward in front of your body, the weight of this, as your head moves forward away from the body, it changes the angulation of how you open and close. Try this at home. Move your head forward, open your jaw. Move your head back into good posture, open your jaw. It will be different. That's an indicator of the cause of TMJ. My job as a chiropractor is to determine, is what you're experiencing in your jaw coming from indeed the structural misalignment of your jaw, causing neurological pressure and interference to the very sensitive nerves, or is it coming from your cervical spine, your neck, which feeds the jaw with nerve supply? So palpation. Is there clicking, grinding, popping? Is there fixation in the cervical spine? Is there, as we examine your opening, so with observation, as you open, and you can try this at home, in front of a mirror, show your teeth, and open slow. Your jaw should swing open and closed. deviations to one side as it opens or closes is an indicator of TMJ joint dysfunction. Furthermore, where is the pain? I'll want to know from you exactly where the pain is located. Observation and subjective findings are very important to finding the cause. So is the pain in front of your ears? Does the pain hurt? Does your jaw hurt when you open? Does the jaw hurt if you close? Does it hurt if you bite? So how we correct it. Now, if there is a deviation in your posture, if there is a deviation in how you open, how you close, we may take an x-ray to see exactly what's going on inside your jaw or your cervical spine or both. This x-ray here behind me, you'll notice the jaw is not centered over the spine. The jaw is deviated. And what we find in our office is that jaw will deviate opposite to the side of the problem. Here's how we correct it. If the problem is coming from the cervical spine, and I'm going to say over the years, I have found that the problem located in the cervical spine, but the symptoms were happening in the jaw. Now, I've also seen that it's both. There's a neurological component to the jaw being misaligned and the cervical spine being misaligned. But there's also a mechanical component. Is the jaw misaligned, creating abnormal stress on one side or the other? And is there abnormal stress happening inside the spine that's creating an abnormal opening pattern because of forward head posture or a head tilt or a cervical shift? Here's how it's corrected. If it's a jaw adjustment, we use a condyle block to support the cervical spine. We stand behind the patient and we take the jaw, if you can imagine the jaw opening and closing, and what we do is we guide it back into the joint, so then swelling, the fixation on the opposite side decreases, thus pain and symptoms. Furthermore, interruption to cervical spine is directed with a adjustment. Typically we see atlas rotation, so C1. Atlas rotation is the key indicator that we find with jaw pain. So rotation of the atlas would be corrected with an adjustment in the chair by moving atlas either to the right, to the left, and then the rotational component has the right side move forward, has the right side rotated backwards. Same thing on the opposite side. So a cervical chair adjustment in the 𝐼𝐻 chiropractic system is contacting the transverse process, leaning the head towards the fixed joint, fixation, and then delivering a gentle force to move the bone back towards a healthier position so the body works better. This is how, at Family First Chiropractic, we get to the root cause of TMJ pain.